Hello, it's The Girl Child. This is the show that's dedicated to addressing the pertinent issues affecting the female child. She has to be healthy to have a fulfilled life. Going by medical records, a large proportion of women are dying from breast cancer, and relentless efforts must still be made at creating awareness. Today on the show, we'll be looking at breast cancer, early detection, symptoms, risk rates, preventive measures, management, and possible cure. But that and many more will be coming your way after the break. Welcome back. It will shock you to know that an estimated 80,000 cancer deaths occur in Nigeria every year. That translates to 10 deaths per hour. Such dreadful statistics inspires a lot of questions about what breast cancer is and what is being done to curb its excesses. So today we decided to bring on the show a woman of substance who has dedicated her life to the well-being of others. She is none other than Dr. Mrs. Lauren Sonijitu Ekpe. She is the president of the Medical Women's Association, Cross River State Branch. Welcome to the show.
Thank you very much.
Now we're looking at breast cancer. Lots of progress has been made with regards to sensitizing people about cancer. But it's so surprising to know that there's still a lot of myths surrounding cancer and breast cancer.
Sure.
What would we say cancer is generally before we go to the topic of the day, which is breast cancer?
Cancer, to the lay person, it's a growth, and not all growths are cancerous anyway, because you could have a benign growth that will not really cause any serious problem, and then the cancers. And cancers are a group of diseases that are characterized by abnormal growth of cells, that the normal cells mutate and becomes an abnormal cells that does not respect the normal biological division of cells. So it grows abnormally, and before you know it, it's out of proportion, and of course causes quite a lot of problems. In this case, we are talking of breast cancer. So cancer of the breast has to do with abnormal growth of breast cells that ends up with serious problems. It could actually, if detected early, could be localized in the breast, or could actually spread as a direct spread, or metastasize, break through the bloodstream to many other parts of the body. In that case, we are talking of breast cancer, because those tissues are breast tissues. They are not supposed to be anywhere else in the body. They are supposed to be in the breast. And so an abnormal division of them now makes these cells not to have the same characteristics as the normal cells, or they don't just have the characteristics of the normal breast tissues.
Okay. Naturally, when we're talking breast cancer, it's usually the women that gets interested and pay rapt attention to listening to what it's all about. Does that say that men also can't have breast cancer?
Sure, men have breasts. If you look, it's just because the male breast is not developed in terms of hormonal stimulation, but the breast tissues are the same. You also have the glands, you have the ducts, you have the fibrous tissue, and of course some men have very large, pectoral regions, and you could find even a lot of breast tissues there, but it's not as developed as that of the female. Yes, men do develop breast cancer.
Okay, we're looking at the division, abnormal division of cells, like what you said. There must definitely be something that has gone wrong in the system before that happens. What actually happens?
In the case of breast cancer, we actually have a breast cancer gene in the body, and that breast cancer gene, if it is expressed just normally, you do not have a problem. In the case of breast cancer, that gene has the mutation, so it now predisposes to development of cancer And that is that gene that when it is transmitted to the relatives causes a family distribution of breast cancer.
Okay. Thank you. Now that takes us to the all-important question. What predisposes one to breast cancer?
Yes, we can't really say there is a cause of breast cancer, but there are a lot of risk factors that predisposes one to breast cancer. Of course, if you had already expressed maybe a breast cancer in one breast, then the next breast is you are higher risk of developing breast cancer in the second breast. Also, if you have a family history of breast cancer, especially in first degree families, then you are more at risk. In fact, 2 times at risk of developing breast cancer. Okay. And if you have a male in your family who have developed cancer, it even also gives you that risk of developing cancer of the breast. In fact, there are a lot of risk factors, and one of them is oral contraceptives. If you have oral contraceptives are also known to increase the risk of developing breast cancer. You will not believe that early menarche also is a risk. The main essence of womanhood, which is the estrogen, the hormone of women, is the higher you get exposed to estrogen, the higher you are also at risk of getting breast cancer. And so pregnancy is known to now be protective, because it is only mainly during pregnancies that you do not have the estrogen. So the later you get pregnant, you are predisposed, as in if you are too old at the age of first pregnancy, then you have had your breast exposed to estrogen for a longer duration of time, so you also at higher risk of developing breast cancer. The one that really amuses me sometimes is the affluence. You know, it has been observed that women who are more affluent, as in the high socioeconomic group of women, are also at higher risk of developing breast cancer.
Why is that
Obesity as well. So those are things that predispose to developing breast cancer.
At this point, we'll take a break, and we will take into the streets to find out just how enlightened the general populace are when it comes to breast cancer.
Hello, my name is Ekanime Kokon. Breast cancer is one of the leading causes of death among women. Today we are at Crutech to find out what people think or know about breast cancer. Have you heard of breast cancer before?
Yes, I have.
Okay, so what have you heard of breast cancer? Can you share?
Yeah, breast cancer is the disease commonly found with women. From the name, it has to do with the organ, the breast organ.
Breast cancer is a form of cancer that affects the breast cell.
It's a general disease for women.
It's a very serious illness that has a very widespread assistance, not just in the nation Nigeria, but around the world.
What is the cause of breast cancer?
Though I can't really tell, but from my understanding, I think it may be due to lack of hygiene.
Breast cancer is something that grows over time, and most times you find breast cancer you don't see it in young women, you see it in aged women.
That I don't really know about it, but I know some women, they put on, they use their, how do they call it, their brassiere as a money, as a bank.
Breast cancer sometimes is caused by genetic factors.
Most times it's caused by carelessness and little attention to one's body system. That's what causes breast cancer.
Number 2, the excess of the breast. If a woman carries excess of breast, can also cause the breast cancer. And the rate that the boys who are training them, the way they suck it, can also cause it very easily.
And sometimes it's caused by unhealthy habits.
Alcohol also contribute to breast cancer. And those mothers that does exclusive too, they are liable to have breast cancer, because feeding the baby also reduces the risk of contracting breast cancer.
Have you heard of how women or girls can examine your breast? Are you aware of it?
Yes, one of the preventive measures for checking up breast cancer is self-examination. I think the best way to do that, most times you're not advised to do it when you're wearing your clothes. You do that when you want to have your bath, or maybe you want to apply your cream or lotion. You just raise your hand up towards your ear level, and then you press your hand round your breast region.
Now that you've heard the cause of breast cancer and effects and what can be done to prevent it, let's take you back to the studio.
Welcome back. Before we went on the break, we found out a few hard facts about breast cancer. With me in the studio is the president of the Medical Women's Association, Cross River State Branch, Dr. Mrs. Lauren Ekpe. Now let's talk about the all-important lifestyle. You know, once in a while you hear people say, oh, don't put money in your bra, or don't put your phone there, and many other things. Could any of these products predispose one to contracting breast cancer?
As far as I know, most of those things, in terms of the phone, we're talking about radiations, the magnetic field could actually predispose, but I don't think there's clear evidence to testify to that risk. But radiations, ionizing radiations are also, in fact, the radiations that predispose very significantly to development of breast cancer.
Okay, so let's talk about the symptoms.
Yes, the major symptom, the most important symptom of breast cancer is, first of all, the lump. When you get to the hospital, the first point of the diagnosis is the medical history. You know, we tend to look down on the medical history, but it has a very great diagnostic power. And then that history will also will bring out family history, will bring out your symptoms, and will analyze them. And then once the doctor suspects that, then there will be a mammography, which is an X-ray of the breast. We also have to note that mammography is done when the person is above 37 years of age. And so for the younger ones, we do ultrasound scan to be able to detect what how the breast is. And any lump also that is noticed, there's a surgical way, the biopsy. You can have a fine needle aspiration biopsy in which you just put in a needle into the breast tissue that you think, where you found the swelling, and bring out cells that will be examined later on. They could also be like going to surgery where you have a general anesthesia, and then that portion of the breast removed and sent to the lab for a test. There are also, especially at the advanced stages of the disease, blood tests that have to be done, of course, to also ascertain whether there is a spread of the disease to other parts of the body or not.
Is it possible for some member of the family to have had a certain kind of cancer, and then that predisposes the other member of the family to another type of cancer?
It doesn't mean that if my mother had a ductal cancer, I will also have a ductal cancer. What really matters is the gene, the fact that that breast cancer gene has mutated, and so it can actually affect any of those tissues with the subsequent relatives.
Okay, what I'm actually saying is there's a case where a son died of skin cancer. A couple of months later, the mother died of another kind of cancer. So I don't know if it has to be like your family history has to be like your mom had breast cancer, then maybe you can be predisposed to breast cancer.
Any other
exclusive?
If what is known is that breast cancer predisposes for you having breast cancer. I mean, I do not know if you have breast cancer and then because it's just a cancer, any other person can develop any other type of cancer. But the risk that has been studied and demonstrated has to link it with other breast cancer in your first-degree relative. Second-degree relative could also be at risk of developing it, but the risk is higher in first-degree relative than second-degree relatives. Yes.
Okay. Thank you so much. Now let's look at the effects of breast cancer, the negative effects. I know that many times the reason why lots of people never like to do a checkup, because when you hear the word cancer, it just sends the shivers down your spine, and it's like there's a death sentence now hanging over your head.
Sure. And it is even more so in this our environment where people believe more in the self-medication, traditional medications, and so on. And of course, you started by saying that there was huge awareness, but I think we still have a lot to do in this part of the world as per awareness against breast cancer. And a lot of women are dying of breast cancer in our communities, in our society. It is true also that a lot have been done, but are we getting them early? Breast cancer, we can cure it, but it can be cured when you find it early. So you must put in place mechanisms for early detection. So if you detect the cancer early, then you have up to 85% chance of curing it, if not about 90. So for now, breast cancer is not a death sentence, but the stage at which it is found. Most of our females present with a fungating, large and ugly mass. At that point, metastasis have occurred, the bones are affected, and of course the liver, the lungs are being affected. Of course, when all those metastases have occurred, there's organ affectation, organ failures and all that, then of course death could be inevitable. And even still in that case, we have recorded quite some successes, about 25% success still.
Okay, medically, how many stages do you have before we could say, or maybe it's too late or something?
There are actually the pre-invasive stages of breast cancer, which are more difficult to detect, but that can also be detected. So if you meet it at the pre-invasive stage, it's very, very good. And then when it starts having stage 1 and stage 2, the prognosis, it's still fine. But by the time you start getting to stage 3 and stage 4, prognosis drops drastically. And of course, as we said, the inflammatory breast cancer, it's a stage 3, so the prognosis is poor at those stages.
Okay, so let's look at the preventive measures. You know, doctors would always tell you that preventive measures are better than the curative ones.
Yes.
And less expensive.
Sure. When we talk of preventive measures, the first is not individual measure. It has to be a statewide policy measure that the country should put in place a policy that screens all women 50 years and above. In some countries, like in the US and in the UK, those preventive measures are put in place. And the large number of women who are picked, of course, will be cured because as at that time, they themselves have not noticed that they were even having a lump. And so in that program, all women 50 and above are just reminded to go and have a mammography done. And the cancer is picked. That is the first preventive measure. And then the second one, of course, the women themselves should be able to know their breasts. If you know the way it looked normally, then you will be able to detect any slight change when it comes. So you should learn to admire your breasts, look at it, feel it, touch it, so you know how it feels, how it is normally. So in case of any change in size, any change in texture, the feel, you will be able to go to your nearest doctor. Of course, the self-breast examination. Every woman must know how to examine her breast for breast cancer.
How often should that be done?
Every day, if possible.
Every day?
Of course. Every day, because it's a routine that we must develop. It is a routine. If you do that routinely, then Of course, you also routinely have the feel of what your breast is. You know, that comes with time, so that by the time you have any slight change, oh, when I touched my breast yesterday, it wasn't like this. But while touching it also, you will be able to bear in mind the changes that comes with the various cycle, the woman's cycle. So you know, no, when I'm about to see my menses, this is how my breast normally feel. So there won't be those false alarm. So that is why we should learn to really, it's yours, why not? Touch it, feel it, and get used to it. And the technique, which is what we may not really be able to demonstrate here, should be taught. And that is one part of the advocacy that we really need to know. But to simply put, we must try to examine our breast. The first stage of that self-breast examination, you have to stand in front of a mirror, just with your hands on your waist. You look at the breast. If you see, as you put your hand on the waist, of course, there could be a dimple, something that was not there suddenly appears, a shift. There could be a shift in the nipple. Then you'll be able to note that. The skin could be red and inflamed. You could notice the difference in size and would say, but some women have 2 different sizes of breasts. They just know this is normal. But when it starts getting out of normal, then you'll be able to know that, this breast is getting larger than it used to be. And then, of course, at the mirror, again, you should be able to check with your hand raised up, any shift or anything, and then gently press on the nipple to see whether there will be any discharge. And that discharge, if the discharge is even worse, if the discharge is bloody, then you have to, once you find anything suspicious, you have to get to your doctor. The last stage of the self-breast examination will be at a lying down position. The lying down position, you go to all the quadrants of the breast. You don't just do this. You have to press the breast tissue on your on the breastbone, right? Rolling from this direction, and you will feel if there is a growth in it, no matter how tiny it is. The lump of breast cancer is hard and distinct. It could either be attached to the underlying breastbone or be or attached to the overlying skin, or could just roll. You could actually feel it like a grain of sand rolling on top of the tip of your fingers. Then you just have to look for medical advice.
Now, let's look at the treatment of cancer. Sometimes we hear radiology and many other things. I don't know.
Oh, please. We're talking of radiotherapy, you mean?
Radiotherapy, is that what you call it?
Radiotherapy.
Okay, let's just look at the treatment of cancer.
Sure. The treatment of cancer is surgical. But you have other forms of treatment, like you rightly pointed, surgical removal of the lump. Then depending on whether the lump has receptors for hormones, you could have hormonal therapy. And then you also have the chemotherapy, depending on the stage of the disease. You could know after surgery you have to apply chemotherapy, which means taking some drugs that will help to suppress, especially in the case where you have spread of that cancer cells to other cells. As we have said, it could spread to the bone, it could spread to the lungs. And then radiotherapy. Radiotherapy is usually for way much advanced cases of cancer.
Well, thank you so much. It's good to know that there's hope for anyone who has cancer. It was a pleasure having you in the studio, and I dare say we'd like to have you back some other time, because the girl child and her health is so vital. Without good health, she can't live a fulfilled life.
Thank you. It was my pleasure coming.
Health, they say, is wealth. So it's my belief that in the course of the show today, if we have picked up a few points that will safeguard us against breast cancer and how to deal with it in events of its occurrence. Next time on the show, we'll be talking about sexually transmitted infections, commonly called STIs. My name is Afi, and do have a fantastic time. Bye.